Hello, can I start?
Yes, ma'am.
Can I start? Warm greetings to everyone. So I hope everyone is doing fine as the current pandemic has reduced in its severity. So I am Dr. Lovina Singh. I am practicing radiologist in Apollo Spectra, Cradle, Sector 82. So this hospital is situated in Sector 82 in the neighborhood, and we have like a lot of facilities available. And I'll be talking about ultrasounds and pregnancies. So I'll introduce myself once again. I am Dr. Lavina. I am practicing radiologist. My special interest is into women's imaging and fetal medicine. So hope everyone is doing fine. So today we will be talking about ultrasounds during pregnancy. Why ultrasounds are done, when ultrasounds are done, and are there any side effects from the ultrasound? There are a lot of questions regarding ultrasounds amongst all the people. So ultrasound is a technology which works on the principle. Am I audible? Ultrasound or sonogram is a non-invasive prenatal test which is offered practically to all pregnant women. So, ultrasound works on the principle of sound waves. So, there is a transducer. The transducer is used to perform the ultrasound by the sonologist. So it is a completely safe modality, unlike the X-ray and CT scan, which work on the principle of radiations. So I hope I am audible to everyone, and we at Apollo have been bringing up a series of Facebook live sessions for all of you. So I would like to start by telling you what are the ultrasounds performed during pregnancy. So, the first ultrasound which is performed during pregnancy is a dating scan which is done at around 6 weeks of pregnancy. This ultrasound helps us in detecting whether a fetus is there in the uterus, whether it is a single baby or a twin pregnancy, whether the heartbeat has come, means whether the baby is alive, or the pregnancy is situated in the correct place in the uterus and not in the adnexa when we call it as an ectopically located pregnancy. The second ultrasound which is done is during the second ultrasound is a specialized ultrasound which is also known as level 1 scan or NT-NB scan. So I just 1 minute. I have a lot of questions been floating around. So first, just let me give a little brief, and then maybe I'll start answering the questions. So till now, I have just started my talk by telling you all how many ultrasounds are done during pregnancy. The first scan, as we already discussed, is the dating scan, which is at around 6 weeks of pregnancy, which is very important to localize the pregnancy, tell us whether it is a live fetus, and tell us whether it is a single fetus or twin pregnancies here. And plus, it also helps to rule out any ectopic mutation of the pregnancy. The second ultrasound which is performed is a specialized scan, which is also known as a level 1 scan or NT-NB scan. So this scan is very important scan to rule out the risk of Down syndrome, or also known as trisomy 21. In this ultrasound we check for any In this ultrasound, we check for any stigmatas of Down syndrome which can be visualized on the scan. So Down syndrome is a condition in which babies can be born with lot of physical and mental disability. So it is very important that we perform this test in the correct time. It is done from 11 to 13 weeks. And in this can we also check whether there is any edema behind the neck of the baby, whether the nasal bone of the baby is present or not, and the facial features, the spinal cord formation, and it really helps the clinician to tell if a pregnant woman is at risk for Down syndrome. So the next scan which is done is another specialized scan which is performed at 18 to 20 weeks of pregnancy, which is also known as level 2 scan or TIFA scan. TIFA stands for targeted, which is also known as targeted imaging for fetal anomalies. In level 2 scan, we do a thorough examination for the fetus. We can check whether the head is fine, the brain development is, the structures of the brain are situated at the like we tell whether the brain is properly formed in the baby. We can tell whether the facial features are normal, there are any neck masses, any diaphragmatic interruptions, or any hernias in the chest. The limbs of the baby are also attempted to be seen in their complete, we see them completely to rule out any clubfoot. The spine is thoroughly examined. The heart is also seen. So level 2 scan is a very important scan in which most of the structural abnormalities can be ruled out. The next scan, which is performed during pregnancy, is a growth scan, which is usually performed during the third trimester. During the third trimester, we need to check whether the baby is growing as correctly, and we also find out whether the surrounding liquid around the baby is in the normal range, what is the position of the baby. And during the third trimester growth scan, we also need sometimes to perform a Doppler scan for the woman to check whether the flow going to the baby and through the maternal uterine vessels is normal, which has very important role in high-risk pregnancies like women who are having pregnancy-induced hypertension or pregnancy-related diabetes. It is very important to check the flow going through the maternal vessels into the baby's head and baby's body so that we can prognosticate the pregnancy and continue the pregnancy. So these are the important times during which scans are held in a pregnancy. Ultrasounds also have an important role during invasive procedures. Suppose we need to do an amniocentesis, choriovenous sampling. If level 1 scan shows some problem in the baby, then invasive testing is required in this ultrasound. Helps the clinician to do the invasive procedure. For example, in amniocentesis, we need to guide the needle into the amniotic sac, take out the fluid, and send it for genetic testing. Ultrasound is also very important for some fetal therapies. These are the current procedures. There are certain current procedures and a lot of research is going on to do some antenatal procedures in the fetus during the pregnancy. We can do amnio infusions, we can do amnio transfusions, and there are many new things also coming up. So now I would like to discuss how the ultrasound scan can be done. So there are two approaches. The first approach is a transabdominal approach in which the woman lies down. The radiologist or the sonologist performs the test with the woman lying on the couch with a transducer. A jelly is applied. The jelly is very important part of the scan because it helps the sound waves to penetrate better. The Another approach through which the ultrasound scan is done is the transvaginal scan. In the transvaginal scan, there is a probe which is introduced into the woman's vagina, and during this procedure, because the probe reaches very near to the uterus and the adnexa and the ovaries, we are better able to visualize the uterus, the ovaries, and the adnexal structures, and the resolution provided by the transvaginal sonography is it's magnified and zoomed to a highest level, and the resolution provided with this the kind of scan is better than the transabdominal scan. So ultrasound is I am seeing one question which is like it's a very important question which most of the pregnant women ask me also. The first the first myth which I would like to clarify today is ultrasound safe during pregnancy? Yes, it is completely safe. It is very wrong to say that ultrasound is a procedure by which baby can be harmed because ultrasound works on the principle of sound waves. Ultrasound is done through a transducer. The transducer emits sound waves which reflect from the maternal body and the fetal body, and there is creation of an image on the computer screen. And it is such a wonderful experience for the pregnant women to be able to see their baby on the ultrasound screen, seeing the baby moving, seeing the baby alive, watching the baby's heartbeat, listening to it. It's, I think it's the most beautiful experience throughout the pregnancy. Though pregnancy is itself a wonderful experience, but being able to visualize is somewhat different. The next, I would like to also, like, I'm just going through the questions and I am including those into my talk. The next, I would like to also tell you about 3D and 4D scans. So, uh, like over here in Apollo Miracles and Spectra, we have a high-end Mollison machine, and we have the 3D probe through which visualization of certain structures is better rather than the 2D probe because 3D in 3D imaging a lot of pictures are acquired at a single point and the machine tries to make a real life image of the baby in which we can watch the facial profile in a better way, like we are more confident to say that this baby does not have a left or if the limbs are normal, the spine does not have any deflections to the right or to the left. So 3D, and when we do it in real time, when we can see the information plus the baby moving, then it becomes a 4D scan, which is real time imaging in the real time. So also I would like to like another myth which is quite widespread is number one I've already discussed that ultrasound is a very safe procedure. It is a revolutionary technology. It does not work on the principle of radiation. It works on the principle of sound waves. It is completely safe to get a scan done during pregnancy. In fact, the meta-analysis by WHO tells that ultrasounds done during pregnancy are completely safe. The number of scans I have already told. First is the mating scan, which is done at around 6 weeks. Second is the level 1 or NP scan, which is the syndromes in the baby. Third is the TIFA scan or level 2 scan, which is done at around 18 to 20 weeks of pregnancy. Next scan is the growth scan, which is done in the